Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Today, I want to talk a little bit about obtaining orthostatic BPs in the field. And depending on who you talk to, some people feel that this doesn't really give you too much value when you're assessing your patient. I personally don't use it all that often, but sometimes it can be helpful, especially when you want to document these types of changes going on with your patient, or you're trying to rule something out that might be happening with your patient that might not be outwardly presenting when you're checking your patient. Okay, so I want you to take this with a grain of salt, but I want to kind of go over the procedure for this, because I think if you are going to do it, it's important that you do it correctly, okay, so that you don't cause any harm to your patient or do it unnecessarily. Okay. Now, it is simple to do, but always remember, guys, you want to follow your guidelines. Some EMS protocols do not allow for this type of blood pressure measurement to go on, because some people simply, honestly, they don't know how to do it, or they're doing it incorrectly or at the wrong time. All right, so let's talk a little bit about that. When do you want to check it? Well, you want to check it if you're looking for for some sort of significant intravascular volume depletion. Okay, you're looking for that loss of fluid in the blood vessels. Okay, so if you're thinking something like that's going on, that's when you're going to want to go ahead and check the orthostatic changes. And you also want to check if the patient has a history of syncope. They just syncopized, now they're sort of coming around, they're alert and orientated, but they did syncopize before you got there, right? So maybe you want to check it for that to see if there's an issue with them regulating their blood pressure. Okay. When don't you want to check it? Well, of course, if the patient is orthomental status, you're not checking it then, right? If the patient can't cooperate, right? They can't stand up for you. They can't cooperate with the entire procedure that you're trying to do. You're not going to be checking it then either, right? Or obvious injuries. Listen, if the patient's got a broken femur or potentially broken pelvis or a hip or something like that, you're not checking it either, okay? And this is the last one here when I put down when they're hypotensive, when they're supine, right? Too many people, to me, I feel, start checking orthostatic changes when the patient's already hypotensive or tachycardic when they're supine. When they're supine and they have hypotension and they're tachycardic, they have orthostatic issues, right? They're already having an issue maintaining their blood pressure. You're not going to want to start sitting them up or staying them up when they're already hypertensive when they're supine. Okay, so that's something that I wouldn't do. And this is when I think a lot of people want to do. Well, your blood pressure is low when you're laying down, so let's see what it's like when you're sitting up. That's not what you want to do, and that's not what this sort of check is for. Okay, so the basic procedure: check their heart rate, their blood pressure when they're supine. All right. Then let them stand up for 2 minutes. After standing up for 2 minutes, check their heart rate and blood pressure again while they're standing. Now, some people will go from supine to sitting and then standing. Listen, we're out in EMS, we're in the field. You don't have all day to be doing this test, right? So some people will just do from supine to sitting. Some people will go just to standing. Again, follow local guidelines. Okay, to me, laying down and standing or sitting to standing, if you're going to have a change, you're going to have a change either way, okay? Now, you're going to have to be considered a positive sign for orthostatic changes if the patient becomes symptomatic, okay? If they get lightheaded, they get dizzy, or they almost pass out again on you, all right? They're going to maybe syncopize again or near syncope again. Okay, and it's also considered positive if you get about a 30 beat per minute rise in their heart rate. Okay, now if it is positive, if the patient does become symptomatic or their heart rate does rise, okay, to that level, 30 beats per minute a rise in their heart rate, then you're going to go ahead and lay them back down, because they are having a positive issue with their orthostatic changes, and you're going to want to have to go ahead and address that. Okay, listen. If you have this type of thing going on, guys, go ahead and treat them according to whatever protocol they might fall in. Now, the patients that have these type of things, they might be dehydrated. Maybe they've been vomiting, having diarrhea or a fever. Okay, maybe they're on some sort of diuretic that they're not taking appropriately, or that's not working for them the way it should. It could be certain medications, high blood pressure medications, beta blockers might be causing them to have these types of changes. They might be anemic, and a lot of psychiatric meds can also cause orthostatic changes, especially if the patient is new to that medication, or there's been a change in dosage that maybe their body's having a problem handling. Okay, I don't want to go too much into all the different causes of it, because there is a lot of causes for it, right? So you're going to be checking this sort of thing out to see if there's a change when a patient sort of seems normal when they're laying down, but they call you because when they sit up, they're feeling dizzy, or because they almost passed out, or something like that, right? So you want to go ahead and check that so you can document, you know what, when they're supine or when they're sitting, they seem fine. There's no symptoms. They're perfect, right? But when the patient stands up or they go from laying down to sitting up, they have significant changes in their blood pressure and their heart rate, okay? So just some stuff to keep in mind if you're going to use this technique to document on your call reports, or you're going to use it to try to rule out something or rule in something what's going on with your patient, okay? This is also, to me, is also a good tool to use when you've got patients, which is I think is common when you get these patients that have a syncopal or a near syncopal episode. You get there, the episode is passed, they're refusing to go to the hospital, right? It's always good to do this type of a check for those patients, because you don't want to walk out of the house, then they get up, start walking around the house and have another syncopal episode and either injure themselves or do not come back from that syncopal episode, okay? So, you know, that's a good sort of tool to use, and can oftentimes be the difference between a patient refusing to go to the hospital and then agreeing, because when they do stand up or they do sit up, they themselves feel a change in their heart rate. They themselves feel dizzy or lightheaded, okay? Guys, this is just very basic stuff, just some techniques on getting orthostatic blood pressure. Again, you want to follow your guidelines, and you want to go ahead and do what's right for the patient. Remember, if the patient's hypotensive and tachycardic when they're laying flat, there's something going on. You need to go ahead and treat that hypotension, treat that tachycardia. It's not the time to start checking out to see if they have any changes. It's gonna change for sure if you sit them up. It's gonna probably get a lot worse than when they're laying down. This is for when they're laying down and the blood pressure is within a normal range of some sort, and you're trying to see if it changes when they sit up or stand up. Okay, just keep that in mind, guys. Don't be using it, you know, for those patients that are already hypotensive. Okay, that's it for me, guys. I hope you can use these Monday minutes. I hope it's something here that you can take away or bring to your practice out in the field. If you've got some minutes of your own, I'd love to hear them. Send them over to me. In the meantime, I do have a brand new CD-ROM called Turbomedic Highlights, and this is some exclusive content from the archives inside Turbomedic On Demand, which is a members-only EMS website with a wealth of study and training tools for EMS professionals. Not everybody can afford the monthly fee. I mean, it's pretty reasonable, about 60 cents a day, but some people just can't afford that, and that's cool, right? I understand that. But why not go ahead, check this out. This is an actual physical CD-ROM where I pulled some of the content out from Turbomedic. This is really unique content. You can add it to your EMS library, refer to it during your career to help you study, refresh on topics. Okay, go check it out. A lot of great content in this first edition of Turbomedic Highlights. Go check it out. Click here for details link below, and go check it out. And maybe it's something you'd be interested in adding to your library there. Okay. Again, guys, that's it for me. If you have minutes of your own, I want to hear about them. Send it to me, please. My email is contact@emsofficehours.com. Until next week, I hope I'll have another Monday Minutes up and live for you. Until then, as always, stay safe.